Hello and welcome to the Board of Health meeting of July 20th, 2020. I'm Judy Giorgio, the health agent for the town of Chatham. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, Chapter 30A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number previously posted and on the screen. The call-in number is 1-508-945-4410, and the conference ID number is 437-525-693#. Now I'd like to turn the meeting over to our chairman, John Beckley.
Thank you, Judy. I'd like to start the meeting by calling roll to establish which members are present. Dr. Ward, are you here?
Present.
Dr. Hanson?
Present.
Ron Broman?
Present.
Ed Sheehan?
Present.
And I'm present. So we have all 5 Board of Health members are on the call. We have 5 items on the agenda tonight. Let's start with item 1, which is a continuance request for sewer extension order at Christine Plummer, trustee, 98 and 100 Oyster Pond Furlong, attorney Howard Cahoon representing. We did get an updated email from Diane. Judy, you want to introduce this issue, this question?
Yes, this was a property, a large property that has several houses on it, 98 and 100 Oyster Pond Furlong, and they had been ordered to connect to sewer. The house has been up for sale for several years. It's a multi-million-dollar property. So Mr. Cahoon has asked for continuances for the last, I think, 2 years. We had continued it to this date, and he has asked that we continue it until our next meeting, which would be scheduled August 3rd, I believe. August 3rd.
No, we said the 17th, Judy.
17th.
Oh, okay. Thank you, Diane. So we scheduled it, we would continue it to August 17th. Mr. Cahoon, Attorney Cahoon has indicated that they have hired engineers and they have plans ready, but he just needed to have a little more time to confer with his clients before he came back to the board with more details. So it would just be a month from now.
Continuance.
Continuance.
Reasonable. Can I get a motion on the table from somebody approving the request for a 1-month extension?
Move we approve the deferrals next.
Okay. Can I get a second?
Ed Sheehan.
Ed Sheehan, second. All right. Further discussion on this issue? Anybody from the public want to comment on this item? If not, I'd like to call the question. When I call your name, please indicate whether you are in favor of the motion. Dr. Ward?
Approve.
Dr. Hanson?
Approve.
Ron Broman?
Approve.
Ed Sheehan?
Yes.
And I approve, John Beckley. So the motion carries and the extension is granted. Okay, thank you, everyone. Item 2 is a variance hearing for a property on 403 Old Queen Anne Road, owned by Gregory Kerkorian. Clark Engineering is representing the applicant. And I assume, Mr. Clark, are you on the call?
Yes, I am. Can you hear me?
Barely. very, very faint,
Is that better?
not much. Do we have a technical? Can I-
Are you there, David?
Yes, I am.
Okay, if you can really just speak up as loud as possible. I'll put the plan up on the screen.
Okay. So the proposal is to build a 2-bedroom house. It's a little bit of an unusual design in that it's a 3-car drive-under garage and 2-bedroom dwelling on the second floor. The property is in a Zone 2, and under the state requirements, because it's under 20,000 square feet, we have to add IA technology. The lot is just over 14,000 square feet in area, and based upon the state's 660 gallons per acre with the use of a nitrogen reduction system, we're allowed to have 2 bedrooms. We submitted floor plans. It clearly shows 2 bedrooms on the second floor. There is a little bathroom and sitting area associated with the 3-car garage down on the first floor, but I don't believe any of those spaces constitutes a bedroom under the definition of a bedroom. That would be my presentation.
Okay, Board of Health member questions or comments?
Yeah, it's Ron Broman. I have one question. It's a 2-bedroom existing house right now, and they want to add on a 3-car garage.
It's a vacant
No, there's
lot.
no house. This is a vacant lot.
Okay, but they're going to have a 3-car garage?
Yes. The applicant actually owns a much larger house here in Chatham, and he likes to tinker with cars, and he needs a place to escape his grandchildren in the summertime. So he saw this lot for sale, and basically wanted to build a 3-car garage, but the zoning bylaw doesn't allow you to build a 3-car garage on a vacant piece of property. The garage has to be accessory to a primary residence. So he decided might as well build living space on the second floor. So primarily the 3-car garage is for his personal use. He's not sure what he's going to do with it. There might be an overflow, living quarters for family members. But that's the purpose of the 3-car garage, basically.
I'd just hate to see part of that 3-car garage turned into a living area along the way somewhere.
Well, your approval requires a deed restriction, so we would be happy to incorporate any.
I know that,
Don. Regarding that.
It's certainly an unusual situation, that's for sure.
Yeah.
But that's a reasonable explanation, I think. Further questions?
Well, Ed Sheehan,
Go ahead, Ed.
I think this should be taken up at another meeting. It seems to me that there's a little bit discrepancy in the conversation. So I think, does everybody else agree that this is what you want to do?
Well,
Alan, I don't disagree.
I mean, it's his property. If he wants to develop it that way, Ed, for his reasons, I don't see what we can do, so long as he complies with the applicable regulations, at least applicable public health regulations.
Okay.
This is
Ron Drummond,
Judy.
it just seems strange to me. I mean, I agree with you.
I think my problem is that I can't hear you very well this afternoon for some reason. And that's my headache. I'll suck up and say that I'll let you boys make the right decision.
Okay.
This is Noble. Judy, so if this was just a regular 2-bedroom residence,
In a 3-car garage.
yeah, I know, but it would fall into the same rules about the septic and it would be allowed with the IA from our standpoint. Is
Yes.
that correct, Judy?
Right. I mean, this is basically a two-bedroom house with a 3-car garage, which really means nothing to us.
Right.
It is a 14,000 square foot lot, and it's in a zone 2 of a public water supply. So he needs to. In our local regulation, if you're not in a zone 2, he would automatically be allowed to have a 2-bedroom house. But since this is a zone 2 of a public water supply, it's a Title V zone 2. It has to put in this IA system. So with, it has to be a provisionally approved system by the state. And David has met all those requirements with the system that he chose, the singular. So I really don't see, I mean, by right, this is kind of allowed.
Right. And Noble again. So the 3-car garage aspect and all that, that's up to, I guess, the planning board or somebody else, not us, whether that falls within the town rules, but.
Right. Yeah, I mean, that would fall to, lot coverage and all of that, building height, that kind of stuff.
Right. Okay.
So, yep. So I don't really have any concerns over this at all. It will be deed restricted to 2 bedrooms, and if he ever did try to do anything to any of that space, it would have to be approved by the health department anyways. So.
Why don't we get a motion to approve on the table? Can I get a motion?
Alan, I move that we approve this plan with the, what are there, 5 provisions?
Six.
6.
Okay. Do I get a second?
This is Noble. I'll second it, but does Judy go over the provisions in her memo
Sure.
here for the
Sure.
public?
Sure. So the conditions would be that the applicant should restrict the property to a maximum of 2 bedrooms and record the restriction on the deed. They shall sign a covenant with the board agreeing to comply with the town of Chatham through its Board of Health and or Board of Water and Sewer Commissions to direct the connection of this property with whatever wastewater management options specified for this watershed. The signed covenant and deed restriction shall be recorded at the Barnstable County of Deeds, and a copy of the executed covenant and deed shall be submitted to the board. Throughout the life of the system, it shall be under an operation and maintenance contract. The O&M agreement shall be in accordance with the Department of Environmental Protection, Norweco, Inc. certification for general use dated January 3rd, 2019, modified October 2nd, 2019. In addition, total nitrogen shall be monitored and a performance standard of 19 milligrams per liter is required to be met. Effluent shall be tested quarterly for the first 2 years, then twice per year thereafter, after approval by the board or its agent. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all landscaped areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations, with a written certification that the system has been installed in accordance with the approved plan and Title V. No alteration of the floor plan of the dwelling or the engineer's site plan will be allowed without further review by the Board of Health or its agent. And this variance is granted pursuant to the State Environmental Code Title V the town of Chatham subsurface sewage regulations is valid for 1 year from the date of Board of Health approval, and a permit must be issued and work commenced during that 1 year period, or the variance shall expire. That was 6.
All right. So there you have the conditions. We have a motion to approve and a second. Further discussion? Anybody want?
Just one question for Ron Brown, question for Judy. Any idea when the storage will be going through there?
That might be more of a question for Bob. If you're paying attention, it's 403 Old Queen Anne Road. It's kind of between the two sections that are in the works right now, so maybe a few years.
Yeah, Bob Duncanson. I would say at this point, probably 7 to 10 years.
Okay.
Judy indicates it's kind of in the middle. We haven't done any detailed engineering. We don't have any town meeting appropriation yet for that area. So taking all that into account, I'm saying probably 7 to 10.
Okay. Thank you.
Yep.
Any other questions? All right, let's vote on this motion as outlined by Judy. How do you vote in terms of the motion, Dr. Ward?
The motion was to approve the request for a 2-bedroom house with an IA system.
Correct.
And the requirements that go with it, those 6.
So how do you vote?
Oh, is that what your question was? I'm sorry.
Okay.
I vote in favor.
Greater Boston Urology, Dr. Weiler.
I've got a phone ringing here. Excuse me. All right, I got this under control now. Sorry about that. Dr. Hanson, how do you vote on the motion?
I approve.
Ron Broman.
Approve.
Ed Sheehan.
No.
No. I vote yes. So we have 4 approved and 1 against. So the motion carries. Thank you very much, everyone.
Thank you, David.
Thank you very much.
Thank you, David.
Thank
Yeah.
you.
We're going to hop to item 5, and then we're going to come back to 3 and 4 just to get a better flow for the rest of the meeting. So I'd like to ask for an update from Dr. Bob Duncanson, Director of Health and Natural Resources. Bob?
Yeah, good afternoon, members and Mr. Chairman. So just a quick update on where we are with the COVID-19 pandemic right now. Worldwide, we are currently over 14.5 million cases, and we have over 600,000 deaths reported worldwide. And as I'm sure everybody's aware, there's the feeling out there that we're probably undercounting both the number of cases and deaths based on the variabilities in different countries, the way they report things, or frankly, if they don't even have the infrastructure in place to report them. In the U.S., we are slightly over 3.8 million cases, which is about 26% of the worldwide total. So the U.S., continues to kind of lead the pack, if you will, in terms of number of cases, and our percentage at roughly a quarter of the worldwide cases is held pretty steady now for quite a while. And the U.S. currently continues to lead, be number 1 in terms of cases. Right now, we have a little over 140,000 deaths in the U.S., and that, again, is about 25% of the U.S. total. Of the worldwide total, and also leads the world with the next highest number of deaths being in Brazil at roughly 80,000. So the U.S. is significantly higher than anybody else in the world. In Massachusetts, as of 4 o'clock this afternoon, because the 4 o'clock update just came out, we are now at 113,789 cases. And I should caution you when I give those numbers, they may be a little bit different than you'll hear this afternoon or this evening on the news, because I continue to report both confirmed and probable cases. Several weeks ago, Mass DPH split them into confirmed cases and then probable cases. And generally, the news reports have only been reporting the confirmed cases. So that's why you'll see a number around 106,000 or 107. But I give you the number of both confirmed and probable cases because that's the way we've been reporting it in graphic form since the pandemic started. Right now, we have 8,433 deaths in the Commonwealth, up slightly from yesterday. And in Barnstable County, we currently have 1,635 cases, and we are holding at 154 deaths, which we've been at pretty much all weekend. The number of cases went up 74 since the last time the board met 2 weeks ago, and the number of deaths in Barnstable County have gone up 4 since your last meeting 2 weeks ago. In Chatham, we are currently at 23 confirmed cases. We had one more confirmed case earlier today, and we are still holding, luckily, at only 1 death of a confirmed Chatham resident. Our case count has gone up slightly, just given the fact that we currently have a lot more people in town and residents have moved back in and whatnot. So our case count's gone up a little bit, over the last couple of days. But as I mentioned last time, most of the cases that we have cleared or are no longer considered active cases. Right now, we're really only tracking 3 cases of those 23 because 23 goes all the way back to the start of the pandemic back in March. So most people have cleared, they've finished quarantine, or they've had a series of negative tests, so they're no longer being tracked. So with that, just a couple of other quick updates. There hasn't been a whole lot of new information, I would say, coming out of the state. As you know, we are in phase 3, step 1. I suspect that we will be in step 1 for most of the summer season. I don't anticipate that changing drastically. So there's been no real changes to restaurants and those kinds of things since we entered phase 3, step 1. There has been a slight uptick in cases on the Cape. For a while there, we were in basically single-digit numbers. We are now back into the double digits, still exceedingly low, but they are trending upwards slightly. And I think, this was something that we all were slightly concerned about with we had the July 4th weekend, we've had the various protests that have taken place, as well as the influx of seasonal residents and visitors, as to whether or not we would see any kind of an uptick in the numbers. We are seeing it very slightly, so we'll just be keeping an eye on that to see how it changes and if it changes in what we would really consider a negative fashion. One of the other things I wanted to just touch on was the testing. You're probably aware from reading it in the press, there is a significant delay nationwide in testing, especially getting test results back. Currently, in some places, it's taking upwards of 2 weeks to get test results back, which is not necessarily a good thing. Massachusetts is doing a little bit better than that because we are no longer, when we first started, a lot of test results in Massachusetts, or a lot of tests were being sent out of state to get the results. More and more testing capability is coming online in Massachusetts itself, and so that's resulted in a decrease in the response time. It's not ideal, and we can still see, differing trends based on the day and how many tests are administered in a given day, as to how quickly the test results are coming back. But they are coming back, faster than we're seeing in some other places around the country. I know you've got 2 items coming up on your agenda, both Schoolhouse Pond and the masks. So I won't touch on those specifically until we get to those agenda items. So with that, I would be happy to answer any questions you may have.
Ron Broman, I just have one comment. It seems strange that this country, leads other countries in our death and that we don't do enough testing or anything. I just think something's wrong when other smaller countries or European countries are doing so much better than we are. It's my political view. Thank you.
This is Noble. I had a question for Dr. Bob, and it has to do with Chatham case counts. Just clarification. So in Chatham, we have a large number of people, maybe 3/4, who are in their second homes or renting, and they're not residents of Chatham. If one of those people come down with COVID-19, that gets, as I understand it, that gets reported back to the town that they reside in. Does the town of Chatham, are we aware of that case? Suppose they're here in their second home and they contract the virus and they're staying here for the summer. Would we know about that?
We might. You're absolutely correct. Generally, the cases are reported back to their home health department, where their permanent residence is. And then, obviously, if they're aware that that person is spending the summer in Chatham, their health department would hopefully call us and give us a heads up about that. But officially, we would not necessarily get notified of it. That is one of the difficulties with the reporting system. And the state is aware of that. It's been brought up on, several of our conference calls with DPH. And they are, thinking about ways that they can address that, given, not only the Cape, but the Berkshires and other places that are, second homeowner heavy, trying to make sure that everybody's aware of a positive case. We have had some instances where seasonal residents or visitors have been transported by the Chatham Fire Department. And so generally we will hear about those cases from them. So, that's why I say in general, not every case we will know about, but we, hopefully we do hear about others. And in some cases we've gotten calls from physicians giving us a heads up because they're aware of the fact that we might not otherwise get notified. So they're, it's not a perfect system. I think it's better than maybe it was several months ago because more people are aware that, they really want to call our health department and let us know about it.
Yeah, Noble again. Yeah, I think that's important because if you look around Chatham now, 3/4 of the people, aren't residents of Chatham. But what about somebody, say, that works in a restaurant but lives in some other town? And they contract the virus. So I would understand we're not automatically privy to that. It might come out with contact tracing, but we don't know for sure.
No, but this is Judy. The restaurants are responsible for contacting us if they have an employee who
They are. Okay, good.
And they do. I have a very good rapport with people. Many of them, even if they are, just remotely concerned about somebody who might have been around somebody who was contacted, they let us know. So everybody seems to be communicating well and touching base with us with questions and concerns when they need to.
Right, because I just bring it up because, we don't want to be lulled into thinking we have fewer cases around here than we actually have, but it sounds like it's an issue that's been dealt with through Bob and the state level. So
yeah,
and it's also being dealt with at the regional level. As you probably are aware, there's a Cape Cod reopening task force, and I've also brought this topic up with them. So they're also working on it because obviously it's not just a Chatham issue; it's a Cape Cod issue. Yeah, but it's difficult. You know, as Judy said, a lot of the restaurants are contacting us. Just for clarity, they are not required to, but, you know, many of them are, just because they recognize, you know, how difficult it could be, and, you know, they want to be as proactive as they can as well, so.
This is John. I've got a question for either Bob or Judy. Is the state of Massachusetts ramped up in terms of staffing so that its contact tracing mission is well in hand?
Yes. Earlier this year, you know, when this thing was really hot and heavy, they hired almost 1,000 people for contact tracing. They have scaled back on that in terms of the number of people they have, just because of the fact that the number of cases in Massachusetts has dropped so dramatically compared to other states. So they have scaled back the number of people they have on the active payroll, because quite honestly, you know, they admitted they you know, ramped way up, and then the needs scaled back, and they were, you know, basically paying people to do nothing. And some people said, you know, they voluntarily stopped, you know, participating because they didn't want to be paid for nothing. But Massachusetts does have, you know, they have maintained all those people on availability, if you will. So if something were to happen and they suddenly needed to ramp back up again, they do have the resources in place. So yes, I think they've done a very good job of, you know, kind of handling the surge, but then scaling back, but being ready if the need arises again.
Thank you, Bob.
And also, John, just so you know, we do have a CTC local health liaison who has been in touch with me over the past several days. I had a conversation with her today. So whenever there's any issue with any cases, if it's been sent to the CTC, or even if it's at the VNA level, I can talk to somebody through either, but the CTC is available at all times for local health. So
I've got one more question. This is John. When I read about some of the discussions about opening schools, I read that there is within those guidelines a reference made to the community positivity rate as one consideration in how to approach the school question. I know, I think I read that Massachusetts has a positive testing rate of, I think, 3%.
It's actually less. It's been down around 1.6, 1.7%.
Okay. Do we have any data for Cape Cod's positive rate of testing?
Unfortunately, no. And that's, you know, that's one of the other things the state's looking at, is trying to come up with more region-specific numbers.
Okay.
Yeah, they've only been doing it as a statewide percentage so far.
All right.
You know, but it's like, you know, kind of learn as you go. You know, there's some ways that we could do, you know, be better with the data. It's just a question of do they have the data? How long does it take to kind of parse out exactly what you want to see?
Gotcha.
But yes, they're aware of that.
Thank you.
No, but just one quick question. Can you say something quickly about, is the gym reopening? And I'm not sure how much we can talk about this. There was one gym that was, I think, was in the process of cease and desist, and there was a question of fines and so forth. Has that been resolved? That they're open now, but has that earlier part been resolved, come to a conclusion in terms of them in the Board of Health town goes? And I don't know what you can say about it.
I think all we could say at this point in public session is it's still in the works.
In the works, okay.
I don't know if you guys, I may have just lost you for a second, but I think the only thing we could tell you at this point is we're still working with the state on the gym issue, and it's still in process.
Yeah, I understand.
The disposition, yes. Okay.
And I just quickly to go back to the previous question, if you take a look at the weekly public health report, which I do send out, it generally comes out on Wednesdays. It does give the positivity rate by community. And Chatham's positivity rate in the last update, which was July 15th, so there'll be another one coming out this week. Chatham's positivity rate was 1.65%.
What was Harwich's, Bob? Do you know?
Harwich was, let's see, I gotta find it. Harwich was 1.87.
Okay. Good numbers. Okay. Thank you. Any more questions for Bob? All right, let's move the agenda and let's move on to a discussion about Schoolhouse Pond Beach. I know that some of us have been thinking about that location with some concerns. I've been doing my own personal surveillance on occasion, and I've seen both days when it seemed to be working well, and I've been there on days when it was clearly overloaded with patrons. And I went today and there were 9 cars parked up on the road and 13 cars down in the lot. And there were a lot of people there. I actually got out of my car and walked around a little bit, and I saw that the people there were trying to distance. I couldn't say that they were 12 feet apart, but they clearly were trying to keep as far apart as they could. So, and that was my impression. And I don't know whether Judy or Bob have other observations, but I'd like to hear them.
Well, this is Judy, and when I've been there, kind of similar, people are doing their best to separate, but very difficult to get 12 feet apart, maybe 10 if they were lucky. And that was midweek. I haven't been there on a weekend. We have had some complaints. I think there was one that was in your packet from a resident that said that the issues caused by on-street parking, large influx of non-stickered and out-of-state vehicles parking on the street. You have to have a sticker, by the way, to park in that lot. And
Judy,
walking in or dropping off people. 7 on average today and yesterday while she was there. Parking lot was not even half full. Better management needed, not seeking to close the beach. So, that's the type of concerns, is that there's a lot of non-stickered people parking out on the street and creating some crowding on the beach.
Mm-hmm. So one possible remedy to address that would be for the town to prohibit parking along the road and restrict the parking and access to the lot down below.
Ron Broman, can I ask a question? Now, I know down below is supposed to be residential stickers. Are there different types of residential stickers, or is there only the one of the residential people that live in town?
Beach stickers.
Yeah.
Yeah.
Well, yes, but you could have a combination sticker, meaning both transfer station and beach in one sticker, or you could have a beach only sticker.
Right.
So yes, there's only one type of category, if you will, but there could be 2 different sticker shapes, although both are the same color.
And then you have the transfer station sticker too. So,
And you have a separate transfer station sticker as well.
right.
So yeah, basically
Yeah.
there's 3 different sticker types. And then there's also a recycling sticker as well. But that
So-
wouldn't get
so
you
what-
necessarily to the beach.
Okay, so a police officer or somebody knew what they were looking for could ride through there and see whether or not these people should legally be there.
Yes, we provide, every year, we provide the police department and other departments with examples of what the current year stickers look like. The size,
Yeah.
the shape and the size is always the same, but we do change the colors every year.
Yeah, okay. Well, I think the idea of closing this up street, parking to the street up above there is one of the only things we can really do. And why do they have the cones in some of the spots down there? I saw a guy moving them, pushing them into another lot when he was down there. I just didn't know what reason they were in the certain parking lots.
The
Spaces.
cones are there as an attempt by Park and Rec to limit the number of available parking spaces. But the problem they've had is exactly as you say, people just,
Yeah.
they come in, they move the cones or they, throw them off to the side or whatever. So it hasn't been the most effective in the world.
No, that's what I thought. I saw it when I was down there.
And this is John. I have to say, in truth, that I did stop there on Saturday and on Sunday. And, the weather was overcast. It wasn't a really good beach day. But people were pretty compliant. So my impression is it depends on the day. Some days it's fine, and other days I think they're over the top in terms of crowded conditions.
Yeah, one of the things is that a lot of people, walk from their cottages down to that beach also. So they're not taking up spaces or anything. They're taking up space on the beach, which will make it much more crowded there.
Yeah.
This is Noble. So the beach monitoring plan, the original reopening plan, I think came from Park and Recs, and then the monitoring, as I understand it, is through Park and Recs primarily. Correct me if I'm wrong. And has Park and Recs, do we know what they think? Have they come to us and asked us for an opinion about Schoolhouse Pond? Because I know they talked about it quite a bit when they had the Park and Recs proposal in front of the Board of Selectmen. We weren't at that meeting, our board. And I think the issue of the on-street parking came up, and I think one of the selectmen eliminated that from the original proposal and wanted to maintain that parking up there. But the question is, who's been monitoring it? Park and Rec, have they asked us for an opinion or some input?
Park and Rec has not directly asked the Board of Health for input. Park and Rec is meeting tomorrow night, and it will be on their agenda again. But we just wanted to make sure it was brought up to you folks just because we in the health department have been getting, not a ton, but a fair number of calls and concerns about the situation. And you're absolutely correct. When originally the beach plan was developed by the Park and Rec Commission, they brought it to the Board of Selectmen. And the idea of banning on-street parking on Sam Ryder Road was removed or not supported. But I think it's certainly something that your board could, if you feel that it would help address the situation, you can certainly make that recommendation to the Board of Selectmen. Because they have the authority over parking or no parking along public streets, if you will.
Bob, did I see that the Board of Selectmen were taking that up on their agenda as well this week?
They may be. Hang on, I'll double check.
I think that's what I saw. So perhaps if the Board of Health is so inclined, we could send a recommendation that the parking on Sam Ryder Road be closed. And that at least would give the lot, would only be for people with resident stickers. It could help, I think.
It would help a little bit, that's for sure.
Well, then you could also pull the cones back and you could open the lower lot for people who have stickers and then gauge it from there. And if that is too crowded, then you go back to restricting some of those spaces with a cone.
Right.
Yeah, I think
Judy?
I was just going to say, I think given the size of the beach that's available there, I don't think I would recommend too quickly taking away the cones.
Okay.
I think there's very limited beach given the height of the pond.
Yeah.
And if all the spots in that parking lot were full, you would definitely be exceeding the guidelines and all on social distancing. So
Okay.
I would rethink, running out and saying, all right, we're going to not allow people to park along the road, but we're going to allow people to fill the parking lot.
Mm.
Yeah, this is Noble. Yeah, I'm thinking that, this recommendation to the Board of Selectmen, I mean, I think we could, I guess, say that we recommend that the Board of Selectmen reconsider banning parking on the street, as was in the original Park and Rec's proposal. And that's a little more general way, I guess, of.
And it is on their agenda. It's item 2 on their
It-
agenda for tomorrow.
But we could sort of voice some support there. I forget the original rationale for why they didn't want to do it initially. That escapes me. Board of Selectmen, that is.
This is Rob Brumman. The only thing we really have control over is the beach, though. I mean, the spacing on the beach and everything, because we have no say over the parking lot or parking off from the other main road up there.
Right.
Is that correct? We only have rights to what goes on the beach.
Well, I would guess we have some concern about the crowding on the beach and how that might be controlled from a
Yeah.
public health standpoint.
That's what we do, just the beach, yeah, the control of how
Well,
many people are
and
on the beach.
the conditions that lead to crowding on the beach. I'm
Mhm.
guessing, I don't know.
Right.
What Bob said before is very important to bear in mind. This pond water height is very high right now, and it takes away probably half of the available beach. And so we have, it's been happening the last few springs. And so I'm wondering whether we should consider recommending a particular sign to be posted down there, acknowledging due to restricted beach area, beachgoers must, be mindful of the importance of socially distancing. Something that gets their attention when they get down there, that acknowledges the unique nature of that location. That's what I'm wondering about.
Yeah, this is Noble. So, but I'm wondering, should we make some kind of a motion regarding parking in the street in order to control the crowds at the beach as a suggestion or a recommendation or something for them to reconsider so that they hear something from us about it?
I like what you suggested, Noble. And I like your wording too.
Yeah, strong suggestion.
We recommend that they reconsider.
Right. Does that sound reasonable, Bob and Judy, that kind of language? Is that something that will have some force with the Board of Selectmen? You don't know, but.
I think it would. Couldn't hurt.
I think it would. Obviously asking them to reconsider is not as strong as simply saying the Board of Health recommends that, parking be restricted.
Yeah.
But that's up to you guys to decide.
Right. But Mr. Noble, so Park and Rec and the Board of Selectmen have been handling this, and so we're sort of getting into it, which is a little different. But I mean, I have no problem saying we recommend that they not park there. It was in the original Park and Rec proposal, and it's kind of an unregulated parking and use of the beach, so it makes sense, in my opinion.
Yeah, I wouldn't get too hung up on jurisdiction right now, just because COVID-19 is a public health issue.
Mm-hmm.
And I think, the board and Park and Rec Commission should be welcoming your input.
Yeah. Yes, it's not so much our actual jurisdiction, it's how it's perceived by other people, other boards and so forth. But I agree with what Bob is saying.
And we could preface our recommendation by saying, based upon informal surveillance of the beach, the Board of Health has concerns about social distancing guidelines being complied with. And to reduce the number of visitors, we recommend, or would recommend, that the Board of Selectmen reconsider the prohibiting parking along Sam Ryder Road as one way to reduce the number of visitors.
Right, and then we would decide, do we say we recommend reconsidering, or do we recommend that parking on the street be banned? There's two levels there.
I could do it either way.
I think we should recommend it.
To what, Ron?
I think we should recommend it to it, not suggest it. We recommend
Okay,
that they close the parking up there.
all right.
And I will make a motion to that if you want me to.
Okay,
I'll make a motion that we recommend to the Board of Selectmen that they eliminate parking up on the main road,
Sam Ryder Road.
Sam Ryder Road.
Alan, I'll second it.
You have a second from Alan. Further discussion? Anybody else want to comment? All right, let's call the question. On the motion, Dr. Ward, how do you vote?
In favor.
Dr. Hanson, how do you vote?
In favor?
Ron Broman,
In favor?
Ed Sheehan,
In favor?
and I vote in favor as well. So we have a motion that's been approved unanimously to recommend that the parking along Sam Ryder Road be prohibited. And then we're going to send this to the Board of Selectmen and copy the Recreation Department.
Yes, I can do that tomorrow, first thing.
Okay.
Yeah, so they get it for their meeting, yeah.
Okay, good. All right. I think that's certainly a good suggestion or a good recommendation. Let's go to our item 5, which is a discussion regarding the mask wearing order on Main Street. I think we all know that this agenda item relates to the fact that people have been observed on Main Street after 9 p.m. not wearing masks. And when questioned, they were quick to say that, well, it's after 9 o'clock, so we don't have to. So the recommendation to us is that we reconsider the wording of our existing order and we adjust the stop time of the order. Currently, Judy, it's 9 to 9.
Yes,
Yes.
that's correct.
It's 9 to 9. And what time does the Squire close? I was told 9:30. I don't know if that's right.
This is Noble. I looked it up on the website and I got the time of 9:30.
You did.
And the other places, the Goose, Bluefin, and the Oyster there, they're stopping at 8 according to their website. So they're not open to 11 and later, like when the bars were going. So it's 9:30 is when things close, I think.
That sounds right.
So what we could do is we could amend our existing mask order to cover the time from 9 a.m. to say 10 p.m.
I have one question. Would it hurt to go to 11 p.m.? Would it hurt if we went to 11 p.m. instead of 10?
Well, I guess the question is how many people are going to be out at 10:45?
I don't know.
And would they feel, you want to go back to the premise of why we did this in the first case was because of the inability to navigate around people on sidewalks and maintain social distancing when there are, a significant number of people there. as the crowds would thin earlier in the morning or later at night, then the need for the mask, I think, the required mask becomes less crucial. So I don't know. What are other
But
people?
you mentioned one time when if they go back to letting the bars open and everything, so they might be open till 10 o'clock. So I'm just saying, make it till 11, and that will take care of anything that happens in the future.
Well, that's one argument.
I mean, bars, I don't believe bars are going to open until phase 4, which means we have a vaccine.
Oh, okay.
Okay, all right.
I think that 10 is probably adequate. I don't even think after 9 there's probably that many people walking around, but
I take my suggestion back then, because I didn't realize that they will not open up until there's, some type of.
This is Noble. I've actually driven on the weekend downtown like 8:30 in the morning, and the coffee shops are open, and there actually are a fair number of people on the streets in the morning, some in groups and all. So I would certainly support the mask until 10. And I'd say the townspeople totally agree with this policy, not totally, but they are very much in favor of it. So I don't think you'll get backlash. But I would support till 10. But if I consider another hour, I would say begin it at 8 in the morning.
we have had a few calls about the early morning coffee drinkers, so.
Yeah, and I think, but most of the people, there were a lot of people down there. Most of them, a lot of them had masks. They're sort of preparing to have masks for 9. So I don't think it would make a ripple in public opinion if we were changing the hours and we made it 8 to 10. They'd say, I think people would say fine. And then if things open up, we would have to adjust it later.
Yeah, but coffee drinkers don't need to wear masks.
Well, but they're downtown walking around the sidewalks.
I get you.
That's true. Yep.
One thing the board may want to consider, and because I'm seeing this in other places around the country. Right now, we allow people to take their mask off when they're eating or drinking. And what we have people walking down Main Street and other places eating or drinking without a mask on while they're, walking through people. In other locales around the country, they're saying you can only take off your mask when you're eating or drinking if you're seated. So just something for the board to consider. And I'm not saying, I've driven Main Street pretty much every day during the week and a couple times now on the weekends and all to see how things are going. And, for the most part, compliance is better than 95%.
Right.
But, if the board does have a concern about, I won't want to say the out, but this idea that you can, get your coffee in the morning and then walk along without your mask on. Some localities have had that as an issue and have addressed it by saying you can only take your mask off if you're seated while eating or drinking.
I like that.
This is Noble. I've had people, this is just anecdotally, say to me that they see people walking around with a cup of coffee and they say, these people are complaining that they're using it as an excuse not to wear a mask. So they don't like it. So what Bob suggested probably would be accepted. The other thing I noticed driving downtown, which I was surprised at, the number of young children wearing masks, not seeming to have a problem with it. I was surprised. That compliance is pretty good.
Yeah.
Yeah, I think for the kids, they're, the parents are smartly making a game out of it.
Yep.
Yeah.
Well, I would be very comfortable if we're going to amend the mask on the time to include an additional edit to clarify the language relating to the waiver for food consumption and beverages to include what Bob said.
The order now says face coverings required by this order may be removed for consumption of food and or drink only when the consumer is practicing appropriate social distancing from persons not of their immediate family unit. So we could clarify that a little bit, or we could leave it the way it is. I mean, we are saying that they have to be socially distanced away from other people.
Right, but then how do you get to that when people are passing you on the left and the right and cutting in front
Right.
of you? And, you know, so I'd rather go with the wording that you got to be seated. Pick a bench, sit on the ground under a tree.
Okay, so I can add that. So when the consumer is seated
And
and is practicing appropriate social distancing from persons not of their immediate family unit. Something language of that.
I would be fine with that. What about the other board members?
It's
I think
noble,
it's
yeah,
a
I
good
would,
idea, Ed Sheehan.
Yeah,
what'd you say, Ed? I'm sorry, I interrupted.
He said it was a good idea.
Oh, okay. Yeah, I think it's a good idea. And then the other thing is so extend to 10. What does the board think about, or someone else about including 8 o'clock, 8 to 10? Is that too much or not to worry or something we should do?
I don't have any information on what happens downtown between 8 and 9. I really don't.
It's anecdotal. I've just driven down and the coffee shops are open and they're sort of lined up. People start lining up going into shops, actually.
I mean, shoppers?
Yeah, I think some of them open at 9 and they only take so many, so they're in lines. Few of them. But I'm not, I'm not, whatever people think there.
I don't know. Judy, do you have a sense of this, or Bob, you want to comment on 8 versus 9 o'clock?
I've been down there quite a few times, like between 8:30 and 9. And I haven't seen the people lining up at the stores yet that Noble referred to. And, there wasn't a whole lot of people. There were still people out jogging and things like that. I don't think it's as big an issue for that hour in the morning as it is the extra hour or whatever later in the evening.
All right. Noble, would you be okay leaving it at 9 as a start and just extending it to 10?
Yes.
Okay. Any other board members want to comment on that? Well, how about we get a motion on the table regarding the two issues we've been discussing here?
This is Noble. So I make a motion that we extend the mandatory mask wearing hours from 9 a.m. to 10 p.m. and that we include language that if you have food, you should be seated while you're eating it and maintain social distance, the language that Judy used.
Okay, good.
Alan, I second that.
We have a second. We have a second from Alan Ward. Any further discussion on this? I'm comfortable with this. How about we call the question?
Yeah, John,
Yes?
just for clarification, because right now your mask order covers Main Street, the Fish Pier observation deck, and Lighthouse Overlook. Is it the board's intent to only change the hours for the Main Street area? Or are you including the other two areas as well? Personally, I don't think there's a need to change the hours for the Fish Pier and Lighthouse Overlook.
Okay.
But I think we just need to clarify exactly where you're changing the hours to.
Well, I would agree with that I'm thinking about the downtown section during these discussions.
I agree. It should just be the downtown.
So then, Noble, would you amend your motion to reflect that the change in, well, what about the consumption thing too? We want that to be only downtown? I guess so.
No, I think that could stay. That could stay everywhere because there's people eating down at the Fish Pier.
Okay. Are there places to sit at the Fish Pier observation deck? I don't even know if there are.
Well, there's a takeout restaurant there, so.
Okay.
and people walk around.
There
drinks.
are a couple of benches up on the observation deck itself. We try to discourage people from eating up there just because it attracts the seagulls.
Oh,
They're
Yeah.
already there anyway, but it just makes them a little bit. So yeah, there are a number of, picnic tables and all in the area, but your order only covers the observation deck. It doesn't cover the entire property.
Bob, I have a question. How do they control the number of people that are going into the fish pier, to the observation deck on the fish pier?
We are not actively controlling the number of people. We have signage of the maximum capacity. We have signage relative to the social distancing criteria. We've marked off the handrail at 6-foot intervals. But right now we don't have anybody posted there, 8 hours a day,
Okay.
7 days a week with a clicker.
Okay, very good.
Oh, okay, so this is Noble. So I would amend my motion to say that the extended mask wearing to 10 o'clock at night, it has to do with the downtown area, but the new language with eating includes all the areas where we have a mandatory mask requirement.
okay. Good. Now, do we have a second for that?
I seconded Alan.
Okay. Any further discussion on this? Anybody from the public wish to comment before the Board of Health votes? Hearing none, how do you vote on the motion just made? Dr. Ward,
In favor.
Dr. Hanson,
In favor?
Ron Broman,
In favor.
Ed Sheehan,
In favor.
and I vote John Beckley in favor as well. Okay, so motion has passed. We've amended the mask order in both ways. We have one more thing to do before we're done tonight, and that is to review the minutes of the July 6th, 2020 Board of Health meeting.
Before we get to that, can I bring up just one other thing?
Uh-huh.
Okay, I've been up, I go to the transfer station sometimes twice a week. And, there's still the issue of the people not wearing the mask up there. But what I noticed that a lot of people drive right by the gate attendant without a mask on. Is it his responsibility to at least mention to them that they should be wearing it? I mean, I know he's probably not paid very much and it's a tough job, but I don't know if he should be saying you're not allowed in without a mask.
Hey, this is Alan. I do that all the time. I put it on when I'm going to get out of my truck.
Yeah.
Yeah, this is Noble. Yeah, I think people generally think that you have to have the mask on when you get out of your car, but if you're in your car with the window up, they don't do it. But
well,
the rule is at the transfer station. So
that's when you go through the gate. You're in the transfer station.
yeah.
I have a big thing about that because I get out and I have a blood issue, so I have to be very, very careful. And I got up there the other day, and there were two guys standing right next to me without a mask on, and I asked them to please put a mask on. And of course, they both started in, but that's all right, not true. What if I'm sick? I don't have to wear one. And this other guy got out of the car on the other side of me and walked down and said that he works for the Massachusetts State Department of Public Health, and they should have their mask on, and they should put them on. And he turned around and walked away. I don't know who he was, but they still moaned and groaned about it, But it really is very upsetting. I'm sitting there and I have a compromised thing, and I have a mask on, and they won't put one on.
This is Noble. I'd ask Judy and Dr. Bob, would it be onerous to ask that gate attendant who's collecting money for special things to check mask wearing of people going by and remind them?
They've already been asked to do that. They were provided with copies of the warning handout that we developed when that was first done. I will follow up with the DPW director and see if we can't ask them to be a little bit, I won't say aggressive, but maybe a little bit more knowledgeable.
Well,
and maybe have a handout.
Well, they already have the handout. They've
Okay.
had it.
Bob,
They've had it for 2 weeks now.
Bob, this is John. I go in there and nobody even nobody even looks out I mean, they don't even step out and acknowledge that I'm there. I mean, I don't think it's unreasonable to ask them to have the person entering open their window and him to say something like, welcome to the transfer facility. I'm just reminding you that masks are required for a while to kind of get people back into the habit of the importance of doing it.
Yeah, I'll speak to the DPW director tomorrow because I know they were initially, at least, they were very aware of the mask requirement. That's why they asked us to include it in the Board of Health order as mandatory. So I'm a little surprised to hear that, they're not being as aggressive in enforcing it as maybe they should be. But I'll follow up with them tomorrow.
Yeah, I don't think they're in the little building. They could just stand outside the building and welcome people.
Yeah.
And use it as an opportunity to remind.
Because everybody's aware of mask. If everybody's saying if everybody wore a mask when they're supposed to, it would really cut down on the cases that we have. So, I mean, it's not asking too much.
Right. All right. Is anybody else want to raise any other minor issues before we get to the Board of Health minutes? Okay, we have the minutes for July 6th. That was were in everybody's packet. Do we have any edits or corrections?
Yeah, this is Alan. Could I ask Diane to try to remember how to spell my first name? It's been 10 years now.
Oh, come on.
Dr. Diaz?
Sorry about that.
Alan, what's the difference? It could be A-L-L.
My mother would roll over in her grave.
Okay.
That's right. I get used to my name being misspelled all the time. I know how you feel.
All right. Thank you.
Sorry, Alan.
Any other edits or revisions or questions about the minutes as prepared? Can I get a motion to approve the minutes of July 6th?
Ed Sheehan, yes.
Ed?
Second, Alan.
Second, Alan. All right, when I call your name, please indicate how you vote on the motion to approve. Dr. Ward?
Approve.
Dr. Hanson?
Approve.
Ron Broman?
Approve.
Ed Sheehan?
Approve.
And I approve, John Beckley. So that's it for the agenda. Can I get a motion to adjourn?
Move we adjourn the meeting, Alan?
Do I have a second? Second, Ron. How do you vote on the motion to adjourn? Dr. Ward?
In favor?
Dr. Hanson?
In favor.
Ron Broman?
Approve.
Ed Sheehan?
Approved.
And I vote in favor as well. So the motion to adjourn is approved. Thank you, everyone, for your participation and your time. That's it for tonight. Thank you.